Communication, Part 1. Why do nurses have to learn about communication? ASIN states that nurses must be as proficient in communication skills as they are in clinical skills. Effective communication supports collaborative relationships and continuous improvement in client safety and quality of care. Communication is that process of exchanging information and generating and transmitting meanings between two or more people. It involves a source or encoder. This is the person or group who begins the communication process, a message or the actual communication product, a channel, which is how the message is sent, and the receiver or decoder of the message, who then has to translate and interpret the message. The receiver will then provide feedback to the source. Many things can distract from the quality of the message, such as television or a client's pain. All of these affect how the receiver may interpret the message. Messages can be influenced from the sender or the receiver based on the person's previous knowledge, past experiences, feelings, or sociocultural levels. Communication is frequently sent through modern technologies such as electronic communication, social media, email, text messages, and especially in healthcare. Telehealth and telemedicine are a couple of means that communication can be sent in healthcare. It improves the availability and reach of medicine to clients who live in rural areas or have transportation issues. There's two types of communication, verbal and nonverbal. Verbal communication will use the verbal and written word. It's based on the words that are used, the sender and receiver's knowledge of those words, and what that person understands of their meaning, how quickly the person talks and presents relevant information, the words that are stressed, how clear the message is, and how long the message is, and how relevant the information is to what is going on. So think about this. If I said that heifer is about ready to drop, what do you think that means? Well, if you were a rancher, you would understand that this means that a cow is about ready to have a baby calf. If I said, did you see the latest presidential debate? I think nectarines are much better than peaches. The second statement has no relevance to the first statement, and it takes the receiver several seconds to switch gears to try and follow the thread of conversation. If I said, it's time to eat, kids, or I say, it's time to eat, kids, there's two totally different meanings. It all depends on where I place the stress of the conversation. How about if I drove down Parallel Parkway headed west? I swear I hit every red light between Highway 635 and Highway 435. So it took me forever to get to Legends. And the traffic was horrendous. Cars and trucks everywhere, and hardly any of them were driving the speed limit. And I just couldn't get around anyone. I didn't think I would ever get to Walmart. Versus, I took Parallel Parkway to Walmart at Legends. It took me longer than usual due to stoplights and the amount of traffic. Same message, but some people may get lost in that first example and not even know what's going on. Nonverbal communication involves transmitting information without using any words and includes everything listed here and more. So we look at touch. Think about placing your hand on someone's shoulder. This can communicate caring, comfort, love, affection, etc. However, if you touch someone who has suffered physical or sexual abuse, this can communicate control or aggression. If someone makes eye contact during a conversation, this can portray attentiveness, interest, respect. If they don't make eye contact, then this can suggest dishonesty, anxiety, or even avoidance. Facial expressions can convey anger, joy, suspicion, sadness, and so on. The client's posture can communicate good health, fatigue, depression, disinterest, etc. How a person walks can indicate happiness or energy levels, fatigue, illness, pain, etc. And how many of us talk with our hands? You can't see me while I'm recording this presentation, but I use my hands a lot to help illustrate a point. Or how many of us tap our feet while waiting for someone to finish speaking? Gestures such as these can indicate impatience, or they can stress what the verbal words are saying, and so on. A person's general appearance and mode of dressing and grooming can indicate health status or educational level, or occupation, hobbies, perhaps even color blindness if they're not matching colors of clothes they're wearing. Also realize that clients are more likely to trust and value nurses who appear competent and confident and focused on the clients who are entrusted to their care. Rudeness, sloppiness, inattention to a person, sexually inappropriate behavior, or other breaches of professionalism undermine not only that specific nurse's professionalism, but also the entire profession of nursing's professionalism. Sounds, even though they are oral, are considered to be nonverbal because they don't use words. They can indicate pain, surprise, fear, joy, sadness, etc. And silence can be a very key nonverbal technique. Most people are very uncomfortable with silence. It can also indicate disinterest, hearing impairment, a lack of or complete understanding, anger, or maybe the client is just thinking. Invading someone's territory and personal space can indicate respect or a lack of respect, intimidation, or a lack of caring or an intent of caring. Be aware that with all of these nonverbal communication techniques, that a client's culture can also influence how a client interprets nonverbal communication. What may be considered as rude in one culture may be considered a sign of respect in another, etc. So as we talk about communication and specifically in the healthcare field, it really helps us develop a relationship. So we have four basic phases. We have the pre-interaction phase. The pre-interaction is basically going to be preparation, where we gather appropriate data prior to the actual interaction, such as getting a report or looking at medical records. We set the stage, such as preparing a room, making sure it's warm enough, we have appropriate equipment, providing privacy, and determining who is going to participate in the relationship. Is it going to be just the nurse and the client? Is it going to be the nurse, the client, and the client's significant others? Orientation phase. This is where the tone and the guidelines of the relationship are set through introductions. It's where we clarify roles and reasons for the meeting. We may be orienting the client to the facility services, the admission routines, and what is expected to happen. It may also include written documentation. So let's say, for example, hi, my name is Miss Taylor, and I'm here to be your nurse today. I'm going to initiate the admission process. This means I'm going to start asking a lot of questions that may be a little bit frustrating to answer, but it's going to help us as we develop a plan of care for you. And I'm also going to get some vital signs and do a real quick basic assessment. That's orientation. I've introduced myself. I've kind of set the ground rules. I've oriented the client as to what I'm going to do and what is involved in that admission process. The working phase will be the longest part of the relationship, and this is where the nurse works with the client to achieve the client's physical and psychosocial goals. This can include provision of physical care, listening, education, all the while providing empathy and emotional support. The termination phase occurs at the end of the initial agreement, potentially at shift change or client discharge or transfer. The nurse goes on vacation or is ill or changes employment, etc. It can include acknowledgement of goal and outcome achievement or progress that has been achieved. Emotions are okay and should be encouraged on the client side, but also should be acknowledged on the nurse's side. There's been many time taking care of various clients. You tend to get attached, and it's okay to tear up or ask if you can give the client a hug or maybe even hold a client while they cry. It's okay to show emotion. Interprofessional communication will occur between two or more people with a goal to exchange messages. Nurses communicate with clients, the clients' families, and other members of the healthcare team. If the nurse cannot effectively communicate with others, then it will influence sharing, problem solving, goal attainment, team building, and effectiveness in nursing roles of the caregiver, the teacher, the counselor, the leader, the manager, and the patient advocate. And then we need to look at ineffective healthcare team communication. It has negative effects on clinical outcomes and interpersonal relationship. It also includes incivility and bullying and verbally and physically aggressive clients. It compromises patient safety. It influences satisfaction with care. It decreases productivity and contributes to healthcare errors and poor patient and staff outcomes. The Joint Commission, which is an accrediting agency, has implemented a code of conduct that defines acceptable, disruptive, and unacceptable behaviors. And it also mandates that a process for managing unprofessional and inappropriate behaviors is in place. And this includes education of employees on the code of conduct, reporting systems, and documentation. Workplace bullying, sometimes we can refer to this as incivility, but incivility is basically rude, disruptive, intimidating, and undesirable verbal and nonverbal behavior and communication toward another person, and is considered a precursor to bullying or lateral violence. Lateral or horizontal violence is anger and aggressive behavior or hostility between nurses. And I just list nurses here because that's what we are. It has a negative effect on the person's behavior and communication. Let me rephrase that. It has a negative effect on the person that this behavior or communication is directed towards. And those effects can include frequent headaches, sleep disturbances, gastrointestinal symptoms, decreased energy, increased stress levels, anxiety, fear, frustration, a loss of self-esteem resulting in burnout, emotional exhaustion, depression, and suicidal ideation or attempt. This type of behavior can lead to decreased job satisfaction, decreased team morale, and compassion fatigue. They're all results of working in an atmosphere of incivility. It negatively influences teamwork, resulting in deterioration of the quality of care and presents a potential for error. Bullying and other disruptive behaviors and inappropriate communication will no longer be tolerated. When disruptive behavior occurs, it's important to maintain that professional demeanor. Respond assertively. Now, this is not aggressiveness. Assertiveness is just standing up for your rights, but doing it in a professional way. And address the issue directly with those involved. Do this in private, preferably, and address the disrespectful remarks or behaviors. Make sure that you follow the chain of command, so you always start with the person that the issue affects. Then if you don't get satisfaction, then you move up to the next person. If you don't get satisfaction, you move up to the next person. The chain of command doesn't mean that you immediately go to the president of the hospital or the CEO. Nurses should also factually document disruptive behaviors or inappropriate communication. Make sure that you leave emotion out of it. Facility policies should be implemented to deal with individual situations in a constructive manner. All staff members should be held accountable for their behavior and communication. Don't put it off on someone else. Well, it's because he said, or I only responded that way because of what she did. Zero tolerance policies should be implemented. Verbally and physically aggressive clients, how do we deal with those? Well, communication is the first line of defense. Using effective therapeutic communication techniques. But if the client is physically aggressive, keep your distance. Never block off your means of escaping the area, and yell or call for assistance as necessary.